Hello, my name is DrLovePooski, and I'm here to bring informative information about sexual health. Today, we're going to talk about gonorrhea and the truth about gonorrhea. So, if you just give me a second to get myself together, I'm going to be sharing some very helpful information with you on today. So, again, my name is DrLovePooski, and I'm going to be sharing to you today about gonorrhea, the truth about gonorrhea. I hope everybody's having a wonderful, blessed day. So, here is the wonderful information. Anyone who is sexually active can get gonorrhea. Gonorrhea can cause very serious complications when not treated, but can be cured with the right medication. What is gonorrhea? Thank you for asking me, because I was going to tell you. Gonorrhea is a sexually transmitted disease. It's an STD that can affect both men and women. It can cause infections in the genitals, rectum, and throat. It is a very common infection, especially among young people ages 15 to 24 years. How is gonorrhea spread? Thank you for asking me. I was going to tell you. You can get gonorrhea by having vaginal, anal, or oral sex with someone who has gonorrhea. A pregnant woman with gonorrhea can give the infection to her baby during childbirth. How can I reduce the risk of getting gonorrhea? Thank you for asking me. The only way to avoid STDs is to not have vaginal, anal, or oral sex. If you are sexually active, you can do the following things to lower your chances of getting gonorrhea. Being in a long-term mutually monogamous relationship with a partner who has been tested and has negative STD results. 1. Using latex condoms the right way every time you have sex. All right? Am I at risk for gonorrhea? Let's find out. Any sexually active person can get gonorrhea through unprotected vaginal, anal, or oral sex. If you are sexually active, have an honest and open talk with your healthcare provider and ask whether you should provider and ask whether you should be tested for gonorrhea every year or other STDs. If you are a sexually active man who is gay, bisexual, or who has sex with men, you should be tested for gonorrhea every year. If you are a sexually active woman younger than 25 years old, woman with risk factors such as a new or multiple sex partners, or a sex partner who has a sexually transmitted infection, you should be tested for gonorrhea every year. I'm pregnant. How does gonorrhea affect my baby? If you are pregnant and you have gonorrhea, you can give the infection to your baby during delivery. This can cause serious health problems for your baby. If you are pregnant, it is important that you talk to your healthcare provider so that you get the correct examination, testing, and treatment as necessary. Treating gonorrhea as soon as possible will make your health complications for your baby less likely. How do I know if I have gonorrhea? That's a good question. Thank you for asking me. I'm going to tell you. Some men with gonorrhea may have no symptoms at all. However, men who do have symptoms may have a burning sensation when urinating, a white, yellow, or green discharge from the penis, painful or swollen testicles, although this is less common. Most women with gonorrhea do not have any symptoms. Even when a woman has symptoms, they are often mild and can be mistaken for a bladder or vaginal infection. Women with gonorrhea are at risk for developing serious complications from the infection, even if they don't have any symptoms. Symptoms in women can include painful or burning sensation when urinating, increased vaginal discharge, vaginal bleeding between periods. Rectal infections may either cause no symptoms or cause symptoms in both men and women that may include discharge, anal itching, soreness, bleeding, and painful bowel movements. You should be examined by your doctor if you notice any of these symptoms, or if your partner has an STD or symptoms of an STD, such as unusual sore, a smelly discharge, burning when urinating, or bleeding between periods. How will my doctor know if I have gonorrhea? I will tell you. Most of the time, urine can be used to test for gonorrhea. However, if you've had oral, anal, sex swabs, may be used to collect samples from your throat and or rectum. In some cases, a swab may be used to collect a sample from a man's urethra, urine canal, a woman's cervix opening the womb. Now, to the meat of the issue. Can gonorrhea be cured? This is very important. Yes, gonorrhea can be cured with the right treatment. It is important that you take all of your medication your doctor prescribes to cure your infection. Medication for gonorrhea should not be shared with anyone. Although medication will stop the infection, it will not do any permanent damage caused by the disease. It is becoming harder to treat some gonorrhea as drug-resistant strains of gonorrhea are increasing. If your symptoms continue for more than a few days after receiving treatment, you should return to your healthcare provider to be checked again. You guys have been wonderful. Thank you. I was treated for gonorrhea. When can I have sex again? You should wait several days after finishing all medications before having sex to avoid getting infected with gonorrhea again or spreading gonorrhea to your partners. You and your sex partners should avoid having sex until you have each completed treatment. If you have gonorrhea and took medication in the past, you can still get infected again. If you have unprotected sex with the person who has gonorrhea, what happens if I don't get treated? I was going to tell you. Untreated gonorrhea can cause a serious and permanent health problems in both women and men. In women, untreated gonorrhea can cause a pelvic inflammatory disease. Some of the complications are of PID, formation of scar tissue that blocks fallopian tubes, ectopic pregnancy outside of the womb, infertility, ineligibility to get pregnant, long-term pelvic/abdominal pain. In men, gonorrhea can cause a painful condition in tubes attached to their testicles. In rare cases, this may cause a man to be sterile or prevent him from being able to father a child. Rarely, untreated gonorrhea can also spread to your blood or joints. This conditioning can be life-threatening. Untreated gonorrhea may also increase your chances of getting or giving HIV. the virus that causes AIDS. Where can I get more information? You can get more information at the STD clinics, or you can call 1-800-CDC-INFO at 800-232-6448. Thank you very much. I am DrLovePooski. I appreciate all the time that you have given me to share this very important information with you. If you join me on your next video, I will be sharing even more information with you about sexual health. I hope you are having a great, wonderful, awesome day. I am DrLovePooski, and I'm checking out. Thank you.